guys, welcome back to my channel. It's Kay, and today I'm going to be talking about 5 different places you can work as a CNA. Now, even though I'm working under my EMT license, the only place I really see EMTs working is in the hospital. I've never seen or known an EMT to work in a nursing home or any of these other facilities. So this is more directed to CNAs, and I have a lot of co-workers that are CNAs, so they tell me their stories, and that's where I'm like getting all this information from. So I'm going to talk about those 5 places that you can get a job at, because I know that it's really hard to get into the hospital setting. Like, sometimes it'll take years for some people, months for other people. Like, it took me months. I told you guys that in my previous video. But in the meantime, if you need a job and you just want some hands-on experience, you can apply to a few other places in the meantime, okay? Before I get started, I want to point out my cute shirt that I'm wearing right now. It says, "I'm not a regular nurse, I'm a cool nurse." Okay, let's see. So, I don't know if you guys can see it. This is from my MotivaTeeLine. So if you want this shirt, you're a nurse and you want this shirt, you can go to my website or my Teespring and get yours, okay? So the first place that we're going to talk about are nursing homes. And this is usually the place where most CNAs start their careers. You know, they start here and then they may move on later on, or maybe they'll stay there for their whole career. I know a lot of people that start off in nursing homes and they retired there. So it just depends on if you like it or not. You know, it's not for everyone, but some people don't mind working in these facilities. A lot of times you're dealing with patients that are very sensitive. You know, it's a very sensitive population. You know, it's elderly people. They may have dementia, Alzheimer's, you know, and many other illnesses that affect older people. And usually they can be total care patients where they can't really take care of themselves. So you're going to have to do a lot for them, you know, maybe feed them. And you got to turn them constantly to make sure that they don't get bed sores. So the pros of working in a nursing home is, one, it's easy to find a job. A lot of times, you know, most CNAs graduate from their CNA program and they can quickly find a job in a nursing home compared to a lot of other facilities. And number 2, it's a great way to start getting your patient contact hours. So if you're doing this for school, you can easily, you know, get some patient contact hours working as a CNA in a nursing home. All right, so let's talk about the cons of being a CNA in a nursing home. So number 1, it's low paying. This is a low paying job, so really don't expect to get rich off of this, okay? A lot of times these facilities are private, so they can't really afford to pay you that much. Number 2, it has a high turnover rate, and that's usually due to understaffing. A lot of times in these facilities, they don't have enough people to cover the amount of patients that they have. So you're going to be overworked and underpaid. Okay. Number 3, you got to do a lot of work by yourself, and that's because usually the RNs or the LPNs, they are just passing out meds because they may have 15 to 20 patients, and they're just going to be passing out meds the whole night. I told you guys my coworker worked in a nursing home, and he told me a lot of times he had to get the patients up and get them in the shower by himself, and he didn't have a lot of help from the LPN or the nurse because all they're doing the whole night is passing out meds. So you can definitely hurt your back, you know, if you're not careful in these facilities, because a lot of times they don't have the staff to cover the amount of patients that they have there. Overall, a nursing home is a great way to start your career. Like I said, it's not for everyone, but it's a great way to start if you want to just get in, get some experience, and then you can move on to something else. Alright guys, number 2 on the list are ALFs, aka assisted living facilities, and these places are basically environments where the patients, actually not patients, residents, if they're in nursing homes or ALFs, they're called residents, not patients, because that's where they live. So basically they promote independence for the residents, so you're basically assisting them in doing their daily activities, from like brushing their teeth to like doing their laundry. You're just basically helping them with these things, not necessarily doing everything for them. And as an EMT, when I went to these facilities, I would see them in the play area. They'll have like a living room or play area, whatever they call it. And they're basically playing games, checkers, cards, and they're really just like getting around by themselves. They have their walkers and their wheelchairs, and they're, doing their own little thing. So these facilities are not, they're not bad. They're pretty independent. And a pro of working in these facilities is that it's low maintenance. You're not doing everything for them, and they can do for themselves, so you don't have to do it for them. The cons of working in these facilities is that they can be low pay, and sometimes they don't have as many benefits as, like a hospital. So compared to the nursing home, you do a little less for the residents, but the pay is probably around the same. So I can't honestly say that I know a lot of people that's worked in ALFs, so I'm not really sure about the job outlook, if it's easy to get a job in these facilities, but I think it's worth a try. I'll find a link and put it below regarding the job outlook, but this is definitely a place that you can consider applying to and just seeing what happens. So number 3 on the list are hospitals. And in a hospital setting, as a CNA, you're basically going to work with nurses, doctors, other techs, and you're going to provide care for your patients. And notice I said patients and not residents. So in the nursing home and the ALF facilities, the patients actually live there, so they're considered residents. But in the hospital setting, they're considered patients because they're like in and out. But this setting is like the ultimate for every CNA. Like usually they start off in the nursing home or the ALF, and then eventually with that experience they get a job at the hospital. So some of the pros of working in the hospital setting is, of course, number 1, the money. It's all about the money. There's so many other benefits, retirement savings, insurance, and just so many other things that you won't find in a small facility. In these private facilities, they don't have the means to provide their workers with many benefits. In the hospital, it's usually a part of a bigger corporation, so they're able to provide their staff with these benefits because they have the income. Okay, so definitely the money is a motive. Number 2, a flexible schedule. A lot of times in the hospital, you're working 12-hour shifts. So you work 3 12-hour shifts per week to be considered full-time. And in the nursing home, you're working 8-hour shifts or 9-hour shifts. So you may have to work 4 or 5 days a week. So, it's a little bit easier when you can just do 3 days and just, get it over with. And also in the hospital environment, you learn more. There's so much going on around you. There are respiratory therapists, monitor techs, what else? Doctors, nurses. There's so many people around you that you can learn from. So definitely you're exposed to more and you can learn so much more. And also you have the opportunity to move up. I've known a lot of people that started off working in the kitchen, and then they moved up to becoming a tech, and then they became nurses. So there's definitely room for moving up and improving yourself in the hospital setting, which is why it's so attractive to so many people. Now we're going to go over some of the cons of working in a hospital setting. So number 1, you're exposed to more and you can learn more, but like I said, you're exposed to more. So there are diseases out there that you can catch, and sometimes, you're in the hospital and you don't know a patient has a certain disease or infection, and you're in the room interacting with that patient, and then you learn later on that they have a certain infection. And that's not good. That's why I always tell you guys to make sure you wear your gloves and your PPE. If someone's like coughing, make sure you wear your mask, because sometimes you just don't know what people have. So you're definitely exposed to more, and you can get sick yourself. And secondly, you're working odd hours. Now, if you're not used to the 12-hour shifts, it could be like a really hard transition. You may not be able to sleep that well. It takes a while for your body to get used to that. So that can be a con for you if you're not really used to it, or if your body is not like wired to do 12-hour shifts. Some people can only do 8-hour shifts, so I guess it depends on the person. Next, it's really hard to find a job in the hospital. And I know some of you guys have been like writing me about like your frustrations about it. But I get it. Like, it took me months to get into the hospital setting. Usually they want you to have at least 1 year of experience. Some people can get in, if they know someone. But a lot of times, you do have to have prior experience in other settings before they'll allow you to work in the hospital. But you just got to keep trying. You got to keep applying, and eventually someone will call you. So number 4 on our list are SNFs, and that stands for Skilled Nursing Facilities. Now, in these facilities, it's basically for patients that leave the hospital and they need some form of therapy, physical therapy, speech therapy. For example, you have a patient that had a hip fracture and they're going to be discharged from the hospital. You can't just send them home. So you're going to send them to an SNF, and in these facilities, they're going to help them recover, help them get out of bed, get moving, and that can take weeks. So a lot of times they're there for a few weeks until they can get around a lot better by themselves, and then they can send them home. So, I don't know a lot of people that worked in these kind of facilities, but I looked up the pros and cons online, and they said the good thing about this facility is that there are plenty of jobs out there. So, if you're trying to find a job as a CNA, this may be the way to go. Definitely apply and see what happens. You just never know. And the con of working in SNFs is that there's a high patient ratio. So you may be, doing a lot by yourself, and you may have like a lot of patients and not enough help. But, this seems like a great starter position, do this for a few months and then, just try and get into the hospital or something. The CNA, the last thing that you can do is become a home health aide. And that's basically someone who takes care of patients in their home. And a lot of CNAs do this when they become burnt out, or, they do it as a side hustle. So they may have, their hospital job or their nursing home job, and then they do this on the side. Because a lot of these positions are per diem, you just pick them up whenever you can. And I've known people that's done this job full time. Like, a benefit of doing this job is that you can do it full time, and then, like, depending on who you're working with, they may, break you off a little something. This person was able to buy a Mercedes because the person that she worked with was very wealthy, and he paid very, very well. She moved and she got a different job, and she was not so lucky. So you can really get lucky with this position depending on who you're working for. So that's definitely a benefit. And also, it's less stressful. In these environments, you're basically choosing where you want to work. So if you work with someone in their home and you don't really like it, you don't have to pick up there ever again. And usually they're working with agencies, so the agency will call them and then they would let them know, hey, you know, they need someone for this house to take care of this person. And most people, like, what they're doing in these settings is really like maybe helping them like take a bath or brush their teeth. And sometimes you don't even have to do that. Sometimes they just want company. They want someone to like sit there and maybe like play a game with them, talk to them. It just depends, really. The bad thing about these settings is that a lot of times you don't have like any kind of medical benefits or health insurance. You know, if you're trying to do this full time, they don't really have the benefits. And sometimes you may go to someone's home that is not really clean, or it may be like uncomfortable. So it really just depends. But that could definitely be a drawback of this position. But overall, a lot of people that I know that do this, they enjoy it for the most part, because all you need is just one good person to work for, and you could be good, you could be set. Guys, so that's it. Those are the 5 places you can work as a CNA. I really hope that this video helps, and I would suggest that you apply to these places, just all these different places at the same time. Like, apply to an ALF, a nursing home, the hospital, apply to different places and see who calls you back. Now, if your ultimate goal is to get into the hospital setting and you're not getting those callbacks, like I said earlier, try, the nursing home first or an ALF and get some experience there, and then start applying to the hospital after a couple of months. And if you know someone that works in the hospital, ask them to hook you up. I've hooked people up and they've gotten the job. And, that's what you're supposed to do. If you know someone and, you can help them out, just go ahead and do that. So don't be afraid to ask for help. So apply and keep trying. You never know what may happen. You just keep trying. Don't give up. And yeah, so that's it for today's video. Thank you so much for watching. Like I said, if you want this shirt, make sure you click on the link below. Make sure you subscribe, because I will be making more videos, weekly videos, so you don't want to miss those. And turn your notifications on so you can get an alert every time I make a video. And yeah, that's gonna be it for today, guys. Comment below, and if you have a video suggestion, make sure you comment and I'll make a video on whatever topic you want me to talk about. Alright, so that's it. Have a great day, great night, and I'll see you guys next time. Bye.